Before we start, a reminder that Lucy Letby faces 22 charges, 7 of murder and 15 of attempted murder. She has entered not guilty pleas to all charges. We are hearing evidence on Child C's death. Dr. Evans heard that infection was a significant factor in Child C's collapse, but could not adequately explain it. He had concerns about Child C's sudden deterioration. As was the case with Child B, the prosecution say Lucy Letby was not the designated nurse for Child C, a baby boy. Letby was assigned to look after a baby girl, and the leading nurse had to reinforce this assignment when the prosecution say Letby was ignoring her. A medical expert concluded Child C was killed by air deliberately put into the nasal gastric tube. The prosecution say this was a variant or refinement of a theme Letby had started with the twins. The prosecution added an independent pathologist said the skin colour changes in Child C were likely caused by prolonged unsuccessful resuscitation. Child C had pneumonia, but the pathologist concluded Child C died as a result of having an excessive quantity of air injected into his stomach via the nasogastric tube. The court has heard Child C was being looked after by a nurse less qualified than Lucy Letby, and had been given the responsibility as Child C was stable. That nurse had left to go to the nurses' station in the hospital. While there, she heard Child C's monitor sound an alarm. Upon her return, Letby was already in the room, standing next to Child C's cot. It was the third baby to have suffered a serious deterioration in a matter of a few days, the court heard. Letby was the only nurse who had been on duty for all 3 collapse incidents for Child A, B and C. In police interview, Letby denied she had anything to do with Child C other than with the resuscitation. She could not remember why she had ended up in Nursery 1. In a second interview, asked about texts which had been found on her phone placing her in that room, Letby said that she might have been sending them from the nurses' station and then gone into room 1, quote, to do something else, end quote. After finishing her night shift, Letby searched on Facebook for Child C's parents. The prosecution say this would have been one of the first things she would have done after that night shift ended. Mr. Johnson for the prosecution added, Letby would have been the only adult in the room when Child C collapsed, as was the case with Child A, and was one of only 2 in the room when Child B collapsed. What we are going to see as we progress is that Lucy Letby's method of attacking the babies in the neonatal unit was beginning to develop, end quote. Child D murder allegation from June 2015. Child D was a baby girl born as full term, i.e. not premature. The court hears there is valid criticism for the hospital, as the mother should have been given antibiotics to stave off infection after her waters broke early, but she was not. Although born healthy, Child D lost colour and became floppy in her father's arms. She was put under observation as she was showing signs of respiratory distress by grunting, and her temperature dropped. Child D was admitted to room 1 in the neonatal unit, placed into an incubator and given oxygen therapy and antibiotics. She developed a very high temperature and a rise in her heart rate. She was intubated and ventilated. She improved significantly, but was still affected by her infection. Child D had catheters inserted and the levels of infection dropped. All good signs, Mr. Johnson tells the court. A designated nurse other than Letby was assigned care for Child D in room 1 on the night shift, along with a different child in room 2. Letby was a designated nurse for the other 2 babies in room 1. On that night shift, Child D collapsed 3 times, the first at around 1:30 am, the second at 3 am and finally at 3:45 am. Mr. Johnson said, quote, on each occasion those attending were struck by the sight of mottling, poor perfusion and black/brown discoloration to her skin, mainly over the trunk. We've heard that sort of thing before, haven't we? The prosecution say that this was another case of injecting a child via an IV air embolus. At 1:15 am, the designated nurse checked Child D, recording observations. At 1:25 a.m, the designated nurse and Letby noted the starting of an infusion. An aspirate drawing liquid through the nasal gastric tube is noted at 1:30 a.m. At 1:29 a.m, a doctor noted an unusual spreading rash on child D. There is a note in Lucy Letby's records. She was engaged in the care of a different baby at the time, but the prosecution say nursing notes suggest Letby and the designated nurse called the doctor to the room. The prosecution allege either the notes recorded were simply inaccurate, or Letby was setting herself up with an alibi in someone else's medical records. Child D was successfully resuscitated. At 2:40 a.m, medication was administered by Letby and the designated nurse, who then left to another room. But child D then collapsed at 3 a.m. Letby was in the room, the designated nurse was not, and no one else had reason to be in the room. Child D was resuscitated again, but according to the prosecution, Letby did not leave things there. At 3:20 a.m, there is a record of Letby starting an infusion, and Letby appears to have remained in the room as a record shows her caring for another baby in the room at 3:30 a.m. At 3:45 a.m, child D suffered her third and final collapse. CPR began and child D was pronounced dead at 4:25 a.m. The coroner gave the cause of death as pneumonia with acute lung injury. Medical expert Dr. Evans, the prosecution says, observed that a child exhibiting a window of near recovery on 2 occasions, followed by another collapse, was not consistent with the fatal evolution of antenatal pneumonia. He added the abdominal discoloration was indicative of air embolus. Another medical expert said the clinical status of child D the previous night was not that of a deteriorating baby who would be dead a few hours later. She added the injection of 3 to 5 ml per kilogram of air would be sufficient to kill. The court is told none of the medical staff on duty that night had also been present for the collapses of child A, B or C, other than Letby. For nursing staff, 2 of the nurses had been on duty for 1 each of the other collapses. Letby in police interview said she, quote, cannot remember, end quote, how she got involved. She seemed to accept that she had administered medication with a syringe at 1:25 a.m, 5 minutes before the first collapse. In a June 2019 police interview, she said she could not remember calling back the doctor when child D collapsed, but it was possible she had. It was put to Letby in November 2020 that she had searched for the parents of child D on Facebook. She said that she could not recall but accepted that she had done so. She said she could not explain why she had done it. The prosecution said, quote, we suggest that if you searched for that family of a baby who you had seen die, you would know and remember why you had done it, end quote. Letby was asked about a text message in which she had referred to, quote, an element of fate being involved. She said that it was, quote, fate that babies get unwell sometimes, end quote, but that she would have to know the context of the message. The prosecution say for child D, her bad luck or fate was the fact that Letby was working in the neonatal unit. The prosecution add all of the children A to D were not expected to have serious problems, but only one of them survived, and only Letby was the constant presence. Child E murder allegation. Child E, a boy, was born premature in July 2015. The prosecution say this is the twin brother of the child poisoned with insulin. Child E was born weighing less than 3 pounds. He was given oxygen, then weaned to air, and transferred to Nursery 1. The court hears child E was at risk of a serious gastrointestinal disorder, NEC, and was started on antibiotics, IV fluids, and caffeine. He had a nasogastric tube inserted. Fluids were inserted the following day via a long line. He had a, quote, mild transient high blood sugar, which was corrected with a very low dose of insulin, then given tiny quantities of milk the following day every 2 hours. The following day after that, he had 2 small vomits and air was aspirated, but otherwise the feeds were well tolerated and increased incrementally to 2 ml every 2 hours. The nursing notes indicated he was stable on a tiny dose of insulin to correct the high blood sugar. The prosecution say, at 9 p.m. on August 3, 2015, the mother decided to visit her twin sons. and interrupted Lucy Letby, who was in the process of attacking child E, although the mum, quote, did not realise it at the time. Child E was acutely distressed and bleeding from the mouth. The mum said Letby attempted to reassure her the blood was due to the NGT irritating the throat. Quote, "Trust me, I'm a nurse," end quote, Mr. Johnson told the court. Letby said the registrar would be down to review child E and urged her to return to the postnatal ward. The mum called her husband when she had got to the labour ward in a call lasting 4 minutes and 25 seconds at 9:11 p.m. Letby made a note in child F's records, child F being the twin of child E, after she had got rid of the mum, Mr. Johnson said. The next time the mum visited child E, he was in terminal decline. The prosecution say the mum was, quote, fobbed off by Lucy Letby. 2 records are made at 4:51 a.m. after child E had died. The latter note records, quote, "Mummy was present at the start of shift attending to cares. Visited again approximately 2200 hours. Aware that we had obtained blood from his NG tube and were starting some different medications to treat this. She was updated by Reg redacted and contained child E. Informed her that we would contact her if any changes. Once child E began to deteriorate, midwifery staff were contacted, both parents present during resus," end quote. The prosecution say Letby's note suggests the mum was present at the start of the shift, 7:30 to 8 p.m, and returned at 10 p.m. when neither is true. The prosecution say 9 p.m. was an important time, as it was the time child E was due to be fed by his mother's expressed breast milk. The mum said that is why she attended at 9 p.m, quote, "She was bringing the milk," end quote. The phone call at 9:11 p.m. to her husband also fits the mum's timing, the prosecution add. Letby's notes also show, quote, "Prior to 2100 feed, 16ml mucky slightly bile-stained aspirate obtained and discarded. Abdo soft, not distended. SHO, senior house officer informed to omit feed," end quote. The prosecution say the nursing notes made are false and fail to mention that child E was bleeding at 9 p.m. They mention a meeting that neither the registrar or the mother remember. A record of feeds, a feeding chart, is shown to the court. At 9 p.m, Letby has recorded information to detail the volume of fluids given via the IV line and the line in child E's left leg, and the 9 p.m feed is omitted. In the 10 p.m column is 15ml fresh blood. The SHO said he had no recollection of giving advice to omit the 9 p.m feed. He was on the paediatric ward most of that night until child E entered a terminal decline. He believes the only time he had anything to do with child E was in a secondary role to the registrar in an examination at 10:20 p.m. The registrar recalled being told child E had suffered a blood-flecked vomit. He does not recall seeing any blood on child E's face, but regarded the presentation as undramatic. But around half an hour to an hour later, there was a large amount of fresh blood which had come up child E's tube. The prosecution said, quote, "This was the first indication of any serious problems so far as the medical staff were concerned. There was a further loss of 13 mils of blood at 2300 hours. 13 mils may not sound much, but the doctor had never seen a small baby bleed like this. This was the equivalent to 25% of child E's blood volume, a figure which the prosecution say is an underestimate in context." The prosecution add that at 11:40 p.m, child E suffered a sudden desaturation. His abdomen developed a striking discoloration with flitting white and purple patches. CPR was started, but child E continued to bleed. Although Letby was participating in the resuscitation of child E, she co-signed for medication given to another baby in room 4. Child E was pronounced dead at 1:40 a.m. The on-call consultant said child E was a high-risk infant who had shown signs of NEC. The parents did not wish to have a post-mortem, the consultant did not deem one necessary, and the coroner's office agreed. The prosecution say, quote, "As subsequent reviews have established, that was a big mistake," end quote. Dr. Evans said child E's death was the result of a combination of an air embolus and bleeding which was indicative of trauma. The air embolus was intentionally introduced into child E's bloodstream via an IV line to cause significant harm. Medical expert Dr. Bohin agreed the cause of death was air embolus and acute bleeding. She concluded that the cause of the bleeding was unknown, but acknowledged fleetingly rare possible natural causes that could not be ruled out in the absence of a post-mortem. Dr. Bohin concentrated on the abdominal discoloration and concluded that air was deliberately introduced via an intravenous line. The court is reminded by the prosecution that, once again, only Lucy Letby was the constant presence for all of the collapses in children A to E. In police interview, Letby said she could remember child E and he was stable at the time of the handover, with nothing of concern before the large bile aspirate. She said she and another member of staff had disposed of the aspirate and the advice was to omit the feed. She said child E's abdomen was becoming fuller and there was a purple discoloration, so had asked a doctor to review child E. She said she had got blood from the NG tube. She was asked about the 10 p.m. note and said if there had been any blood prior to the 9 p.m. feed, quote, she would have noted it. She said it was after 9 p.m. that the SHO had reviewed child E, but she could not recall if it was a face-to-face or over the phone. She said she could remember the mum leaving after the 10 p.m. visit. In a June 2019 interview, she was pressed over a conversation with the SHO. She said she had no independent memory of it. She said she could not remember the mum coming into the room at 9 p.m. with milk, nor the child E being upset with blood coming from the mouth. She said she would not have told the mum to go back upstairs. Quote, "We have a stark contrast between what the mum says and what Lucy Letby says," Mr. Johnson tells the court. "You know he was due to be fed. Breast milk. You know we say that is why the mum was there. This has been wiped out of the records by Lucy Letby because she knows the consequences of the mum being right about this." In a November 2020 interview, Letby is asked why she had sent a text referring to child E and queried whether he had Down syndrome. She said she could not remember whether there had ever been any mention of Downs in the medical notes. The prosecution say Lucy Letby, quote, "took an unusual interest," end quote, in the family of child E. She did social media searches on the parents 2 days after child E's death, and on August the 23rd, September the 14th, October the 5th, November the 5th, December the 7th, and even on December the 25th. The prosecution say there were further searches in January 2016. Mr. Johnson will now be giving details of the prosecution's case for child F, the twin brother of child E. Child F attempted murder allegation by method of insulin poisoning. The prosecution say child F was marginally the younger of the twins and he required some resuscitation at birth and later intubated, ventilated and given a medicine to help his lungs. He was recorded as having high blood sugar, so was prescribed a tiny dose of insulin. He had his breathing tube removed and was given some breathing support. Child F had small amounts of breast milk and given fluid nutrients via a long line. If it is known in advance that a baby cannot have milk and needs to be fed fluids, then a TPN bag is prepared by the Aseptic Pharmacy Unit APU and a COCH on receipt of a prescription. The pharmacy bag is delivered back to the ward and is bespoke, prepared for an individual patient. If, for whatever reason, there is no need for a TPN bag, there are a couple of stock bags kept in reserve. As a matter of practice, insulin is never added to a TPN bag. Insulin is given via its own infusion, usually in a syringe which delivers an automatic dose over a period of time. The prosecution adds insulin is not added to a TPN bag as it would stick to the plastic or bind to the bag, making it difficult to accurately give a reliable dose. Early on August 4th, child E had died. Later that day, the pharmacy received a prescription for a TPN bag for child F, the twin brother. A confirmation document was printed at 12:32 p.m. for child F. The pharmacist produced a handwritten correction to say it was to be used within 48 hours of 11:30 p.m. that day. The TPN bag was delivered up to the ward at 4 p.m. that day. On that night shift, a designated nurse for child F in room 2 was not Letby. Letby had a single baby to look after that night, also in room 2. There were 7 babies in the unit that night, with 5 nurses working. Letby and the designated nurse signed the prescription chart to record the TPN bag was started and administered via a long line at 12:25 am. A TPN chart is a written record for putting up the bags and was used for child F. It includes lipids, nutrients for babies not being given milk. Letby signed for the TPN bag to be used for 48 hours. There are 2 further prescriptions for TPN bags to run for 48 hours. Following the conclusion of a Letby night shift, after the administration of a TPN bag Letby had co-signed for, a doctor instructed the nursing staff to stop the TPN via the long line and provide dextrose, sugar, to counteract the fall in blood sugar, and move the TPN to a peripheral line while a new long line was put in. Child F's blood glucose increased before falling back. A new bespoke TPN was made for child F, delivered at 4 p.m. The prosecution say this could not have been the same one fitted to child F at noon that day, which would have been either a bespoke bag which Lucy Letby co-signed for, or a stock bag from the fridge. Mr. Johnson said child F's low blood sugar continued in the absence of Lucy Letby. Child F's blood sample at 5:56 p.m. had a glucose level which was very low, and after he was taken off the TPN and replaced with dextrose, his blood glucose levels returned to normal by 7:30 p.m. He had no further episodes of hypoglycemia. These episodes were sufficiently concerning that medical staff checked child F's blood plasma level. The 5:56 p.m. sample recorded a very high insulin measurement of 4657. Child F's hormone level of C-peptide was very low, less than 169. The combination of the 2 levels, the prosecution say, means someone must have been given or taken synthetic insulin. It's the only conclusion. We say this means that somebody gave child F synthetic insulin. Somebody poisoned him. All experienced medical and nursing members of staff would know the dangers of introducing insulin into any individual whose glucose values were within the normal range, and would know that extreme hypoglycemia over a prolonged period of time carries life-threatening risks. No other baby on the neonatal unit was prescribed insulin at the time. Mr. Johnson continued, to give child F insulin, someone would have had access to the locked fridge, use a needle and syringe to remove some insulin, or if they didn't do it that way, go to the cot side and inject the insulin directly into the infant through the intravenous system, intramuscular injection, or, and this is what we say happened, via the TPN bag. Medical experts Dr. Evans and Dr. Bowen said the hormone levels were consistent with insulin being put into the TPN bag prior to child F's hypoglycemic episode. You know who was in the room, and you know who hung up the bag, Mr. Johnson told the jury. Professor Peter Hindmarsh said that insulin had to have gone in through the TPN bag, as the hypoglycemia persisted for such a long time, despite 5 injections of 10% dextrose. Professor Hindmarsh said the following possibilities happened. That the same bag was transferred over the line, that the replacement stock bag was contaminated, or that some part of the giving set was contaminated by insulin from the first TPN bag, which had bound to the plastic and therefore continued to flow through the hardware even after a non-contaminated bag was attached. There can be no doubt that somebody contaminated that original bag with insulin. Because of that, the problem continued through the day. Letby was interviewed by police in July 2018 about that night shift. She remembered child F but had no recollection of the incident and, quote, had not been involved in his care, end quote. She was asked about the TPN bag charts. She said the TPN was kept in a locked fridge and the insulin was kept in that same fridge. She confirmed her signature on the TPN form. She had no recollection of having had involvement with administering the TPN bag contents to child F, but confirmed giving child F glucose injections and taken observations. She also confirmed signing for a lipid syringe at 12:10 am at the shift before. The prosecution say she should have had someone to co-sign for it. She accepted that the signature tended to suggest that she had administered it. Interestingly, at the end of this part of the interview, she asked whether the police had access to the TPN bag that she had connected. In a June 2019 police interview, Letby agreed with the idea that insulin would not be administered accidentally. In November 2020, she was asked why she had searched for the parents of child E and F. She said she thought it might be to see how child F was doing. She was asked about texting child F's blood sugar levels to an off-duty colleague at 8 a.m. She said she must have looked on his chart. Mr. Johnson told the court, "The fact it was done through the TPN bag tells you it wasn't a mistake. Whoever was doing it was to avoid detection. Only a few people had the opportunity. We suggest there is only one credible candidate for the poisoning, the one who was present for all of the unexpected collapses and deaths at the neonatal unit." End quote. Child G attempted murder allegations. 3 attempts. Mr. Johnson said child G, born in May 2015 at Arrow Park Hospital, was a baby girl and born very premature, weighing 1 pound and 2 ounces. Child G suffered bleeding on her lungs and had 9 blood transfusions, with a number of septic or suspected septic episodes requiring antibiotics, but improved and was transferred to the Countess of Chester Hospital's neonatal unit in August and was clinically stable, being fed expressed breast milk. On the night in September, child G was in nursery 2, with a designated nurse, not Letby. There were 7 babies in the unit with 5 nursing staff. It was a milestone night for child G, and nurses marked the occasion with a small celebration. Child G was being fed every 3 hours alternatively by bottle and nasogastral tube. At 2 a.m, a feed had shown minimal aspirated partially digested milk. The nurse took her scheduled 1-hour break. Nothing is recorded on who was asked to keep an eye on child G, Mr. Johnson added. At 2:15 a.m, the shift leader said she was sat with Lucy Letby when she heard child G vomiting, along with child G's monitor alarm going off. They ran into her nursery. Child G had vomited violently and suffered a collapse. The prosecution said medical records suggest the shift leader's memory of being with Lucy Letby for a period of time before this event cannot be accurate. The prosecution say, despite child G's stomach being pretty much empty prior to her feed, 45 ml of milk was aspirated from her NGT. But the prosecution say 45 ml of milk had been administered for her feed, which then did not explain what accounted for the vomit. Subsequent x-rays showed air in the abdomen and intestines. Child G suffered further deteriorations. During intubation, a doctor noticed blood-stained fluid from the trachea, something the prosecution say was consistent with what was seen in other collapses in the case so far. At 6:05 a.m, following a further desaturation, 100 ml of air was aspirated from the NG tube. When the tube was removed, the registrar noted thick secretions in her mouth and a blood clot at the end of her breathing tube. There were also signs of infection. Child G was transferred to Arrow Park before returning to the Countess neonatal unit just over a week later. 5 days after her return to the Countess, child G was due to receive her immunisations. Such was her improved condition. A team of nurses came on the day shift that day, Lucy Letby being among them. Letby was child G's designated nurse that day. Child G was fed with 40 ml via NG tube by Letby at 9:15 a.m. At about 10:20 a.m, child G had projectile vomited twice for several seconds, the court is told. Child G's blood saturations fell to 30%, the same problem she had faced 2 weeks prior. A nurse took over the care from Letby at 11:30 a.m. as Letby was looking after 2 other children in room 4. The nurse took all the observations and noted child G was connected to a Masimo monitor, which measures oxygen saturations and heart rate levels. It is a device which stays on and cannot be turned off by a baby. At 3:30 p.m, a consultant doctor was called to cannulate child G. Privacy screens were erected and child G was on a trolley with the monitor still attached. The nurse went on to care for another baby. The consultant doctor said he could not recall if child G's monitoring equipment was switched off during the cannula fitting, but it is his practice to transfer the sensor from one limb to another, or if temporary detachment is required, to reattach the monitor as soon as possible. He added if child G was not stable, he would not have left her. After the doctors had gone, the nurse responded to Lucy Letby's shout for help. When she attended, child G's monitor had been switched off. The power was off. Child G was struggling to breathe. Letby was giving ventilation breaths. Child G responded to the treatment. In a text sent by Letby to a colleague, she wrote, child G, quote, Looked rubbish when I took over this morning. Then she vomited at 9 and I got her screened. Mum said she hasn't been herself for a couple of days." End quote. But the prosecution said child G had been due to have her immunisations, something which would not have been completed if child G had not been well. The prosecution say child G had vomited because she'd been given excessive milk and air. A subsequent MRI scan revealed neurological changes, and in August 2016, it was revealed child G had suffered irreversible brain damage. Mr. Johnson said, quote, "Someone had switched off the monitor when child G collapsed, and she was discovered by Lucy Letby. The overfeeding doesn't happen by accident." He added similar cases will be heard with other babies. In police interview, Letby said she remembered the nurse had been on her break when the incident happened with child G in nursery 2. She could not remember who had been assigned to look after her. Letby suggested that excess air in child G after the vomiting was the result of some sort of infection or as a consequence of the vomiting. She said she had withdrawn the 45 ml of milk after that episode and air had come with it, and she had seen child G vomiting. She said she did not know why she had gone into the room, but it was possible it was a result of hearing child G vomiting. Letby, quote, vaguely recalled the day child G vomited after her return to the hospital, accepting she had been the designated nurse. She had no recollection of child G vomiting. In a subsequent interview, Letby accepted there were only 2 alternatives to the first vomiting incident: that child G had been fed far more than she should have been, or she had not digested her earlier feed. She accepted that the clear inference to be drawn was that child G had been given excess milk and air via the NGT. She denied responsibility for either of those eventualities. For the second incident, Letby denied either overfeeding or injecting air into child G's stomach. In November 2020, Letby denied to police that she had switched off the Massimo monitor. She was asked about Facebook searches carried out on the day of the second vomiting incident that Letby looked up the parents of child G. She said, quote, "She had no recollection of them," end quote. The prosecution say that within a minute or 2 of looking at the mother of child G on Facebook, she then looked at the mums of 2 other babies listed in the charges. One was the mum who the prosecution said interrupted the attack by Letby on child E. Mr. Johnson states, "The practice of the nurses on the NNU was to use the NGT to check whether an infant had an empty stomach before feeding. That was done in child G's case. Nothing came up, which means there was nothing in her stomach. She was then fed and her designated nurse went on a break. 15 minutes later, child G produced projectile vomits of such force that they left the cot and landed on the floor and nearby a chair. Child G collapsed and stopped breathing. An amount of feed was aspirated from her NGT equal to what she had been given about 15 minutes earlier, together with lots of air. There was a similar episode a few weeks later. These were not naturally occurring or random events. They were deliberate attempts to kill using a slightly different method, whilst Lucy Letby sought to give the appearance of chance events in the neonatal unit at the Countess of Chester Hospital." Okay, so let's leave this episode here for today. Now, naturally, this is the most heartbreaking and tragic case I've ever covered regarding any case that I've looked into. But it is a case that I plan on following from the very start to the very end, at least where the trial process is concerned. So if you wish to keep up to date with the Lucy Letby trial, don't forget to hit the subscribe button, hit the notification bell to be notified on when my next video goes live. I thank you all for joining me today for this video, and I look forward to seeing you all again for the next one. Take care. Cheers.